Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Advanced care planning is important for everyone, especially later in life. We spoke with an expert at UMass Memorial about this important step. What is an advanced care plan?
Advanced care plan is a way that people can make sure that their wishes and values and preferences for medical care are respected, even when they can't make decisions for themselves. It's a way of articulating their wishes and to talk to family members and their physicians about what their priorities are. This can range from talking about, do I want particular medical interventions done or not, to what are my values and what's important to me. So what quality of life am I willing to live with? And these things can be documented in a number of different ways. In Massachusetts, there's a form called the MOLST form, M-O-L-S-T, and that's available on the website.
So how is an advanced care plan different from a healthcare proxy?
In the state of Massachusetts, having a documented living will or a documented advanced care plan doesn't have any legal or fixed standing. So that serves as a document to advise physicians or advise especially your appointed decision maker, who is your healthcare proxy or agent. So we recommend that everybody select somebody that they trust and who they have spoken to about their wishes, who will be the person that doctors turn to when somebody no longer is able to advocate or speak for themselves. It is in my belief that everybody who has a healthcare agent should let that person know what their wishes are. So while they might not need the MOLST form, which is a medical order, everyone should have a plan in place with that communication with their healthcare decision maker, their healthcare proxy or agent. The MOLST form in particular, which is the medical order version of advanced care plan, is something that I would say anyone with serious illness should have, because it's the only way that their wishes are sure to be followed when they're outside of the hospital setting, should someone come upon them and they're unable to speak for themselves.
How can someone access these forms?
The healthcare proxy form, that can be downloaded on the website. You can ask your primary care doctor, any of your physicians, or if you go into a healthcare facility, they'll have the Massachusetts form that you can get. An advanced care plan, it can be a letter that you send to your family member, your healthcare proxy. It could be an email that you send to your physician and say, please note that these are my wishes. And we've actually developed something online. You can see the website below as a means of helping people think through what those questions are in an advanced care plan in a more thoughtful and methodical way. It can be also accessed through my patient portal. And the MOLST form, the Massachusetts order, which again is something that a person would have their physician sign as well as themselves sign, so it turns those wishes into a medical order, is something that you can download or ask your primary care doc or any of your physicians about, and they will be able to review that and fill it out. What I would recommend with any of these forms is to hold on to a few copies for yourself. Make sure that your healthcare proxy and family members have a copy, and make sure your doctors have a copy as well.